For decades, testosterone has dominated the conversation around men's sexual health. Low libido, erectile dysfunction, mood swings. Testosterone has often been seen as both the problem and the solution. But new research is reshaping that view, pointing to a deeper and often more accurate predictor of male sexual well-being: metabolic health. Specifically, glucose control is emerging as a key factor in determining not just performance, but also fertility, hormonal balance, and long-term vitality. This represents a shift away from a narrow hormone-focused model toward a broader understanding of how the entire metabolic system affects male sexual function. At the heart of this shift is the realization that sexual health doesn't operate in a vacuum. Erections require healthy blood vessels and nerves, both of which are sensitive to blood sugar levels. Sperm production depends on tightly regulated energy processes, which are easily disrupted by insulin resistance and oxidative stress. Even testosterone itself is influenced by metabolic state. Men with elevated fasting insulin and higher body fat tend to have lower levels of free testosterone, even if their total levels fall within the normal lab range. In short, metabolism shapes the entire sexual ecosystem, and glucose control sits at the center. What's surprising to many men is that these issues often start before any diagnosis of diabetes. Prediabetes and subtle insulin resistance can damage vascular function, disrupt hormone signaling, and impair sperm quality years before blood tests reveal anything abnormal. For example, men with HbA1c levels just below the diabetic threshold may already show reduced erectile function or poor sperm motility. Yet, because they don't fit the traditional profile of someone with a health problem, young, active, normal weight, they are often overlooked until the symptoms become more severe. This disconnect between visible health and metabolic risk is one of the reasons men's sexual symptoms are frequently dismissed or misattributed. But there's a powerful upside to this new understanding. Metabolic health is dynamic. While age and genetics are fixed, blood sugar, insulin sensitivity, and inflammation can be changed, often rapidly, through diet, exercise, and stress management. Studies show that even shorter improvements in glucose control can enhance erectile function, boost testosterone, and improve sperm parameters. For men struggling with sexual performance, this opens a promising and non-pharmaceutical path toward recovery. Rather than relying solely on testosterone replacement or ED medications, many can benefit from addressing the underlying metabolic dysfunction that caused the symptoms in the first place. There's also a broader implication here. Sexual health may be one of the first areas where men feel the impact of poor metabolic regulation. While atherosclerosis, kidney disease, or neuropathy may take years to develop, issues like reduced performance, infertility, or low libido often show up much earlier and may act as early warning signs for deeper systemic problems. Instead of dismissing these symptoms as personal or psychological, they should be treated as metabolic red flags. The future of men's sexual medicine may depend on this more integrated view, one that sees sexual health not just as a matter of hormones or desire, but as a reflection of overall metabolic resilience. Glucose control, far from being a niche concern, may hold the key to unlocking better performance, fertility, and long-term well-being. By shifting the focus beyond testosterone, we're opening up a more holistic and actionable framework, one where men can take control of their health not just for better sex, but for a better life.